As a parent, there's nothing more terrifying than seeing your child struggling to breathe. Choking is a real danger for young children, and knowing how to react quickly can be the difference between life and death. It's scary, but with a little knowledge, you can be prepared to handle this situation like a pro. We're going to walk through the steps together so you feel confident in taking charge if the moment ever arises. Remember, your calmness can make all the difference for your child. It's important to distinguish between choking and gagging, as they require different responses. Gagging is a natural reflex that prevents choking, and often a child will clear the object on their own. If you see your child gagging, stay close and monitor the situation. However, if the gagging persists or you suspect choking, it's crucial to act swiftly. Choking occurs when an object obstructs the airway, preventing breathing. A child who is choking might suddenly grab at their throat, their face might turn red or even blue, and they may be unable to cough or make any sound. Time is of the essence in these situations. Knowing the universal sign for choking can also be life-saving. If a child is clutching their throat with one or both hands, it signals they are choking and need immediate assistance. If your child is exhibiting any of these signs, it's crucial to stay calm and take immediate action. Remember, your composure can make all the difference in helping your child. In the next section, we'll discuss the appropriate steps to take for babies under 1 year old. Choking is a serious concern for babies due to their small airways. Act quickly and calmly if you suspect choking. Can your baby cough or cry? This is a good sign. Encourage coughing to dislodge the object. If not, intervene with back blows and chest thrusts. Lay your baby face down, head lower than chest. Deliver 5 back blows between the shoulder blades, then give 5 chest thrusts. Stay calm and focused. Section 4. The Heimlich maneuver, a life-saving technique. For children over 1 year old, the Heimlich maneuver is the recommended method for dislodging a choking hazard. This technique involves applying abdominal thrusts to compress the diaphragm and force air out of the lungs, hopefully expelling the object. To perform the Heimlich maneuver, stand behind the child and wrap your arms around their waist. Make a fist with one hand and place it just above their navel, with your thumb facing inward. Grasp your fist with your other hand and give quick, upward thrusts into their abdomen. Continue these thrusts until the object is dislodged or the child becomes unresponsive. If the child becomes unresponsive, carefully lay them down and begin CPR. We'll discuss CPR in the next section, but remember, time is of the essence. Section 5, CPR, when every second counts. If your child becomes unresponsive during a choking emergency, it's crucial to begin CPR immediately. CPR, or cardiopulmonary resuscitation, helps circulate oxygenated blood to the brain and vital organs. For infants under 1 year old, CPR involves chest compressions and rescue breaths. Place 2 fingers on the center of the baby's chest, just below the nipple line. Give 30 gentle compressions at a rate of at least 100 compressions per minute. After every 30 compressions, give 2 rescue breaths by tilting the baby's head back, lifting their chin, and sealing your mouth over their nose and mouth. Continue cycles of 30 compressions and 2 breaths until help arrives. For children over 1 year old, CPR follows a similar pattern, but with some modifications. Place one hand on the center of the child's chest, on the lower half of the breastbone. Push down at least 2 inches at a rate of 100 to 120 compressions per minute. Give 2 rescue breaths after every 30 compressions. Remember, CPR should only be performed on an unresponsive child who is not breathing or only gasping for air. Section 6. Prevention, the best medicine. While knowing how to respond to a choking emergency is essential, prevention is always the best approach. By taking a few simple precautions, you can significantly reduce your child's risk of choking. First and foremost, always supervise your child while they are eating. Encourage them to sit down while eating and to chew their food thoroughly. Cut food into small, manageable pieces, especially for young children who are still developing their chewing skills. Avoid giving your child hard candies, popcorn, nuts, grapes, and other foods that are common choking hazards. Keep small objects, such as coins, buttons, and small toy parts, out of reach. Babies and toddlers explore the world by putting things in their mouths, so it's crucial to be extra vigilant during this stage. Teaching your child about food safety from a young age can also make a difference. Encourage them to eat slowly, chew their food well, and avoid talking or laughing with their mouth full. By instilling these habits early on, you can help keep them safe during mealtimes.